Thank y'all. It's a pleasure to be here, and I guess even though the PBR, if you call it fame or not, kind of made me a little bit more visible than I already am. Through the country, the show, and forgive me, but show cattle is probably my first passion. The only real hobby I've got in life really was showing cattle, and I just graduated this last spring, so it's kind of morphed to breeding them now, and then following the cattle that we bred on down the trail. But I can tell you there's nothing more fun than having one that you bred and your family showed win a breed. We never did have the opportunity to have a grand, but we did have a reserve. Unfortunately, it wasn't one we bred, but it's sure one that we put a lot of time with. And the show deal's near and dear to my heart. I've got 3 kids. The first 2 are both veterinarians, and this one here wants to go. And I never have spent much time with them other than showing cattle. And I'd like to think, and they say that it was an integral part of their youth, and that was one of the reasons why they decided they wanted to go to veterinary school. It wasn't because Dad wasn't ever home practicing. So with that, these beasts that we deal with today, and I'm not going to sit here and give you a bunch of formulas, give you a bunch of withdrawal times, tell you a bunch of drugs to do this or that. We're going to talk some about using drugs. We're going to talk about maybe a roundabout withdrawal time, but the first thing is, and I apologize for my passion a while ago, but this is a great, and it is an industry, and it is somewhat separated from the regular beef cattle production that a lot of you do every day. And it is become a big part of my practice, but it's still beef cattle. They're still beef cattle, and they still respond much the same way. We just have to use our training along with the science that we know and the experience that we've developed in order to prescribe properly for these animals. And when I say properly prescribe, that comes with a proper diagnosis. And I'm going to remind all of y'all right now, right or wrong, the first key in everything is diagnosis. You can't diagnose over the phone, and a lot of these people want you to diagnose them over the phone. Gals texted me a while ago and said some people drove 5 hours after a conversation I had with them yesterday about a swollen leg, and I told them that I couldn't properly diagnose that on the phone, so I couldn't tell them how to treat it. Now, and I am animate about this prescribing or dispensing medications for folks to keep at home to treat their animals. We're, I think, probably one of the few areas of the world that allows that to happen. I know for a fact the guys in Australia and the guys in Europe don't dispense on a broad basis. And the reason why this is more of a passion for me is because we've become more intimate in the stocker business here of late, and it's appalling, absolutely appalling, particularly out in the grazing areas of West Texas, how unscrupulous our profession is with the dispensing of medications. It's not, I'm not saying you need to stop it, I'm saying it's got to stop. And you got to get the word out there that it's got to stop. Because we're going to eventually, if it doesn't, we're going to lose this opportunity. And there's going to be a lot of kids left out when it's all said and done, because the public, if they ever find out what goes on, is not going to stand for it. Unfortunately, because of man's selection and management, we have a tendency, and after 35 years of being in practice, I think I can say this: man can screw up more than what God can fix. And with our genetic selection and with the guys that we got judging shows, we have to deal with it now. But these guys are bred full of problems structurally. Now, I'm going to say that genetics play a part and management plays a larger part. And all we can do is try to fix what we're presented. And that's what I'm going to go to do today. And we've got a very busy practice. It's gotten busier. I probably didn't get to put as much time in this as I should. And in speech 101, they taught me never apologize for your talk. I'm not apologizing for it. I'm just going to tell you that the flow may get off a little bit because one of my secretaries helped me put this, or primarily put this together. But we have bred a special set of cattle for this. And I'm talking about cows today, and I'm talking about beef cows. And I'm not even going to talk probably as much about purebred cattle, although they have some all breeds are now having this problem, particularly the ones that are not of American influence. But they too have problems. But we have taken these cattle for appearance and bred some problems in them. 70% of the genetics out there today go to one bull. One bull. And I had the good or misfortune to have to deal with him back 5 or 6 years ago and all his clones. And I'll tell you right now that clones inherit everything that the donor had too. So there's no, I mean, out there in the industry, some people think the clones are okay and the donor has the problems. That's not true. And all the progeny, all the sires that comes from that sire propagates the same problem. And 70% of the show steers we see out of that sire or his sire lines after him will have issues related to structure. We're going to try to show you some of them. I've tried over the years to take pictures and videos, but we never learned how to catalog them properly. So going back and finding them at the last minute could be a little difficult. But y'all, and this is for your education because as soon as we get done with Houston, they're going to be going and buying. Well, they're buying new steers before Houston, and there's some insurance company now that are not only insuring cattle for mortality but also loss of use. The loss of use deal is critical that you look very closely at structure. And a tip-off of structural abnormalities to develop later on in these cattle are looking at that back leg and looking at that muscle structure. Those guys that are real powered up, and when I say powered up, I mean they're stout. You can drive a car down their top, and they stand about a foot apart on their back wheels. Those are the guys that are going to be most predisposed to having some of the issues that we're going to talk about later. This is not a bad back leg, but this thing here is a little straight. You look at him in front, he's pretty straight up and down from the point of that shoulder all the way down to that foot. And looking at them and knowing, the problem we get into, I think, these structural issues would not be quite as bad if these cattle weren't pushed from day one. They're actually, and we're going to talk about that too, genetics play a part, management plays a bigger part. For those of you that don't know how this cycle goes, these guys are born, they see a creep feeder by 60 days, they may wean them at 5 months and put them on full feed because fat sells. And the bloomier these guys are, the more people like them. And the hairier they are, the more people like them. The people that are in this business, for the most part, are not cow people. And when they go to look at one, they want to look like a baby doll. And so baby dolls sell. And this deal is a big deal. I mean, for those of you that aren't intimately involved, it's not uncommon now for mom and dad to go spend $30,000 for a steer, $50,000 for a steer. I had the misfortune to have to work on one that was insured for $100,000 a show steer. So that's an exception rather than a rule, but it is out there. So we need to keep all those things in mind as we go forward. I put this picture up not because he's a great steer or he's got a problem, but to remind me that it's really about the kid. It ain't about the steer. It's about the kid and the family. And us old cow veterinarians have to sit ourselves down sometimes and remember, we're talking about a family pet. We ain't talking about a cow. And those people are willing to do whatever they can to maintain that pet and maintain that project. And we can't say we can't do anything and just ship them. We have a responsibility to these people. We have a responsibility to the animal to step out there and do the very best we can for them. If you don't know or you're not experienced enough to know what to do for that animal, you owe it to them to refer it to somebody that can. This is just an outline of some of the things we're going to go through, and I'm not just going to include the genetics, but the other things that can happen to these guys. Sepsis, trauma, infections via the own body, the hematogenous route. We see some that we suspect may be immune related. The development of genetics and management. All those things can come into play. We want to look at this because this is the number one problem that we're presented with, and that's an arthrosis or swollen joint. In show cattle and steers and heifers, the number one is a tarsus or hock that we see. We see this presentation. It's difficult to deal with by the time we get that much effusion in the joint. We're gonna see the number one problem that causes this in a little bit. But when we get one that's just diffusely swollen, it's difficult to ever get them back 100% normal. They can have this and not be lame, although most of the cattle that we're presented with this kind of effusion will show some degree of lameness, and we're going to try to look at some videos here in a minute to qualify that. Talk about acute, and unfortunately, I get a lot of calls, I get a lot of cases come in that this has been going on for 2 weeks. They've treated at it, but their treatments that were prescribed for them weren't effective because nobody knew what the organism was that was initiating this. And I'm going to tell y'all right now that parenteral therapy alone, dealing with one of these, don't work. You've got to get very aggressive in your treatment, and you've got to get aggressive early on. Treating them for 2 weeks and then sending them to me or sending them to the veterinary school, you're probably not going to have a desirable outcome because the damage is done. The damage is done. And having a sense of when you're presented with this, of how long it's going on, is critical in figuring out what you do. We put this slide in there just to show that I'm a big believer in joint lavage. This bull was not septic. It was from an ACL injury, but I'm huge. I believe in lavaging joints for a lot of different reasons. Okay. Now, y'all, this is upside down. When you take, and I'm going to tell you something else. The iPad is the greatest tool man's probably ever invented for a veterinarian. I find, and I don't know why because I'm not a big gamer at all, but I can look at a lameness and film it on an iPad and come back and look at the iPad, and I can see more on the iPad than I can looking at them live. I don't. Maybe that's just me. And this is just this guy's, bless his heart's got multiple problems. You can see him paddling in front. He's gimpy on the right rear. I mean, he's just a wreck. And I just put it up there for you to see. We have and we'll see this particularly in the spring, particularly in these calves that come down from up north, and the steer jockeys, as we call them, the guys that are peddling, particularly the higher end exotic cattle, are primarily the ones that are doing it. They're bringing these calves out of Illinois and Michigan and Minnesota and wherever, and they commingle them. They bring them down here. They've been through hauls. Sometimes it takes them 2 days to get here. And they've got these shaggy little beasts. It's got not only long guard hair, but they've got this primary hair underneath that does most of the insulation, a crinkly, fine hair that acts like a wool blanket on these calves. And they come from up there where it's 20 degrees in the daytime, down here where it's 70 or 80, and they get fried. And when they get fried, they will not clip the hair off of them. And so those cattle get stressed, they get pneumonic, and then they can get septic. And I think cattle are very predisposed to generalized bacteremias, and that we see, this is when we see issues with the joints. Not just from pneumonic cattle, but other reasons. But in the early stages, that's that's a big issue. Trauma is another one, probably not as, we see more from a hematologist standpoint than we do from trauma, but puncture wounds, you probably, it may be difficult to see the reaction back there on the tuberculosis, but this steer had an early infection. He's got some gas, some subcutaneous emphysema there that had a really pronounced cellulitis in that joint. Lacerations are another big issue. The other thing I'll say is self-medicating at home. Parents that think they know what they're doing, they just go and stick a needle in a hot joint to drain it, and you get a secondary bacterial infection there because they weren't clean with their synthesis. So just some things to remember. Trauma is another one. This is a stifle injury. We just put that up there so to show you the obvious effusion. This, of course, this deal was chronic. As you can see here, the lateral outpouch in the stifle joint. Those things are just to remind us about trauma. I'm big on looking at the joint fluid. This is a typical effusive type reaction to a joint injury that we'll see. This is going back to what I'm talking about lavage in joints. I think the blood that ends up in the joint after an acute injury is probably just as devastating as a bacterial infection in some of these animals. I feel like you got to get that stuff out of there and get that joint cleaned up and cooled down. We'll talk about treatment there a little bit. It just goes back to septic joint right here. This is the kind of fluid that we'll usually get out of a cow when they've got a hot infected joint. And it's real difficult, and that's what I'm saying. You got to jump on these guys or you're behind the 8 ball. This is a bull that was acutely, I guess I messed that up. Let me see here. Just to show you how one of these guys move around. Actually, he's a couple of 3 days post-treatment. You'll see his legs shaved. We do a vascular perfusion as well as lavage. The joint's affected. This bull was 3-legged lame when he came in. You can still see he's real effusive in that carpus. I put this up here to remind us all. I'm going to tell you what, in cattle, and some people may refute me, but that little buddy right there helps me probably as much diagnostically and treatment-wise as anything. Evaluating their temperature. Also, the degree of lameness. If one comes in packing a leg, you can bet that that's a pretty serious issue, whether it's a foot abscess or he's got a carpus infected or a tarsus infected. And here's the other, probably not so much the CVC as a fibrinogen. I put great stock in that. The higher that fibrinogen, I think the more serious the issue that we have. And I don't use this. I use this maybe more for myself as an initial prognosticator as I do for evaluation of treatment long term, because it's very slow to drop in my hands. So, but those factors all help me. That and radiographs help me evaluate. Also use it for treating non-septic conditions. We've used a lot of this in the past, trying to reduce inflammation. Some of that came out of our treatment of bucking bulls, where we'll do a vascular perfusion on the limb with dexamethasone. Really nice way to approach it. Talking about treating septic joints, we'll also use, and also arthritic joints. We'll do a lot of joint lavages. They work well. Of course, we're not worried so much on chronic issues using antibiotics. If you've got a chronically infected joint, the best thing to do is try to open it, drain it, and fuse it. But we do like to lavage with antibiotics on an acute septic joint. And I'm a big fan of this, and I may get my fanny in a crack because of it. But it sure, there was one point where there was a lot of controversy about DMSO. We'd actually talked to clients about, look, this animal can't never go to slaughter. I've had some people say you can't even do that, but we make the call that if we're going to use a drug that's questionable or not allowed, we're going to have them sign a statement saying this animal will never go into in the food chain. And I don't know if that covers me or not, but I don't know when to quit, so we do that. Just an example, I thought we'd throw this in there just to prove that we do what we say we do. This is lavaging a coxifemoral joint in a bull. Now this thing had been, gosh, 45 days lame before he came there, and I told the guys there was little or no chance that we could salvage, that he was going to be salvageable. They wanted to do it because they wanted to try to harvest the genetics out of this calf, because we knew we were working with this, and this is the best film that we could get of this thing without having to put him under anesthesia and go down to the equine to use a big machine. But this is a radiograph of his coxifemoral joint that was just lavaging, and you can see the lysis of bone in the femoral head, as well as in the joint surface here in the ilium. Systemic treatments when we're dealing with those septic joints, and I say this because of all the presentation of cases that I've had, and the approach is, we've got an animal that is immune system is compromised, or this probably wouldn't have happened to start with, and I always try to use a cidal drug when I'm treating these guys initially. Bless the man that developed the COX-2 inhibitors. They are wonderful in cattle. And we've found no issues so far with long-term administration of those as far as any effects on organ systems. So I am a huge fan of the COX-2s, and I hope that we might be able to address their use extra label and trying to figure out withdrawal time for them. I talk about this last. We do see some of these. I don't have all the answers of what I'm beginning to think is immune-mediated synovitis or arthritis, if you will. In the spring, we'll see some of these northern cattle come down here. They're very effusive. They're very lame, and I hate to even say this, but most of them are in the right stifle joint, and I have yet to be able to figure out why that is, but they are non-responsive to antibiotics. These guys are febrile, they're effusive, but the difference in those cattle that we see versus everything else, they have a milky synovial fluid is the best way I can describe it, with no fibrin. And you can flush them 10 times in a row. Those may be responsive to us suppressing the immune system, and I just haven't been brave enough to try that yet on them. But a very interesting clinical presentation that I don't have an answer for. And like I said, they present as any other septic joint, except that fluid is cloudy or milky look to it that has very little fibrin accumulation. Chronic lameness, getting the point a lot of y'all probably want to hear about, and that's talking about OCDs. OCD lameness is in show steers and heifers is probably 70% of the cause of the issues you see, and probably 75% of that 70% of lamenesses are going to be due to found in the tarsus. Very, very big issue, and it goes around breed. I'm not going to say that Brahman-influenced cattle won't have it, but we sure rarely see it in American-influenced cattle. And I think it's just a dilution of the genetics, probably, for the most part. I just put this up there. Of course, she would be mine too, but this heifer's had 3 sibs that have been champion Bremers at the majors in the last 2 or 3 years. But structure's real important in these guys. I was talking a while ago, and you can see that heifer's got a real nice set to that back leg. She's got some functionality here, good angulation on the forelimb as well. Just a nice put together kind of a package as opposed to this. Of course, this is a bull, but just an example that was readily available. of where the exotic industry's gone. He's too straight back here. He's too straight up there. And these guys, when we find these more posty-legged cattle, I can guarantee you at least about 70% of those post-legged cattle, if you took digital radiographs, you're going to find OCD lesions somewhere in that hock. And I say digital because we suspected that we had to deal with OCD problems 20 years ago, but until digital radiography hit the mat, we didn't find them, couldn't find them. And even some of the lesser digital machines, you may not find them. You have got to have good image quality to find these, but I guarantee you if you have good image quality, you're going to find them. The number one predilection site for OCDs in the cattle, of course, is in the tarsus. And in the forelimb, it's the shoulder. I've got to the point now, we still, because of my early teaching in equine medicine and lameness, is you always start with a foot. We still start with a foot, but if we don't find anything in the foot with hoof testers and everything's normal in the interdigital space, we're going right to the shoulder. And we block every one of these shoulder lamenesses we see, we try to block out. Now, I will tell you that 100% of them will block to a point, but probably half of the ones that you put anesthetic in a shoulder joint are going to totally respond and be completely sound. The other 50% is going to be on a grade of 1 to 9 as to how well they respond. You may still get a little bit of pain, even with a good anesthetic delivery. The other prognosticator, more so, in any joint in these guys, is treatment and how they respond to treatment and how long treatment holds them is a good prognosticator of how serious the lesions are, particularly if you can't take radiographs. This is a heifer. You see her slinging her left front shoulder out. That's because she's got an issue in her shoulder, and we've got the next video is after we blocked her left shoulder. And the interesting thing, once we get her walking, is you'll see her tracking normal on that left shoulder. And I just did this from a front to back view so you can see it better. But you'll see her land directly with that foot underneath her, but now she's slinging the right one out. So some of these, I mean, it's not uncommon at all to see a mirror image lesion in the leg that doesn't present. So you want to remember that if you're blocking one leg, you want to also go back and block the next one. Here is, this steer's got a left rear lameness. Watch him hesitate there, keeping his weight off. Now here is after he's blocked. And we didn't swap guys just to show y'all that there was a different set leading him in, but he's traveling free, and now he's stubby on his other leg, right rear leg. And this is a steer. I'll just tell you, we ended up, we spent half a day blocking him out as we finally got to the hip on him. And this steer's, look at the way he's traveling that left rear. He's up on his toe. He's not bearing full weight when he shifts over on that leg. And now it's after he's blocked. He's putting his weight down. You'll notice, well, maybe not this point now, but maybe if we get him, I think he comes back. Yeah, excuse me, I'm walking. We're still learning how to use the iPad and doing filming, and we hadn't learned how to edit very well. But you can notice that this calf is putting weight all the way on this leg now, and he's putting that heel on the ground. Of course, you can see where we scrubbed him and blocked him, but sometimes you have to invest some time in these guys. These people have to be aware that you're doing so. I've struggled with this for a long time. Structural issues in these animals and trying to help the kids get them to show. Because in a way, it's not fair for those kids that have had no issues with their steers. The problem that I have is the industry. And the industry has supported the development of this, and maybe, and Allison, I'm not trying to commit any or create any controversy with y'all, but maybe it's in the shows. We have the same guys judging down here every year. It's the same little group, and they give structure. They acknowledge it, but they don't use it. They don't do it when they're selected. We have steers out there that guys make a comment on there. Well, he's starting to buck over a little bit out here in the final drive, and we use him anyway. Why? You gotta talk the talk and walk the walk. And these judges that ignore structural soundness, why do we go get them? We got enough guys here in Texas now, be it there's some issues with who knows who and so forth, but I think the integrity of some of the younger judges we got right here in this state would bypass all that. We need to be paying attention to structural soundness. Now, there's an argument on the market animals that they only got to walk from here to the truck. Well, we're looking for that ideal. We're looking for Miss America here, or Mr. America. And we need to all come together and say, this is a criteria we want. We expect the judge. Those judges are smart, okay, or they wouldn't be where they're at. But it's to the shows, if we as an industry in Texas decide that that's where we need to go, then we need to suggest to the livestock shows that they talk to these judges and say, hey, we want an emphasis on structural soundness. If he can't walk, if he don't flex, and put it down there. I mean, give them a deal and say, we want to see that steer move like Secretariat. You know, we want to be able to flex and move and do all these things and put a little heat on them so that they do it. The dilemma that I've always had is that mom and dad went and paid $5,000 or $10,000 for a calf that I know medically I can help. Okay, so because these problems don't occur before tag in. 99% of them don't. And they don't ask me, should they buy this steer or not, before they go buying. And then they've got a guy out here that's collected their money. He don't want to give it back. Okay, he's not going to give it back. So they're hung. So the way I have finally convinced myself that I'm okay doing this is I'm helping them try to recoup some of that investment. They may not, that steer may go on the truck, but they've at least had the opportunity to show him. And look, I've had some of these guys say, there's one sitting in my clinic right now. I said, guys, no mas. We're done. Give up. And they're still sitting there hoping and wondering and probably going to come back and say, will you try it again? And I'm not, because he can't be helped. He's bucking over. He's done. Unless somebody's got a magic treatment in here that I'd love to hear, we're done. And so, yes, I kind of try to talk the talk, but when we've got an effusive hock in here that I know medically I can help, I'm going to try to help them. But what I'm saying is some of those same effusive hocks come in and they're like this. And Shockey goes and slaps that one, Champion, a little bit of influence coming from somewhere, and I got a big issue with who's recommending, because we're seeing this same cycle, and I'm on the inside. I know what's going on, and I'm saying we need to look at somehow to change that judging cycle, because I've got a lot of friends that are ag teachers and extension agents, and I'm just saying there's a little bit of influence driving the train, and it needs to change. We need to get a fresh set of faces that aren't connected to give these kids a fair shot. And they don't all, trust me when I'm telling you, they don't all get a fair shot. As far as the dilemma of treating cattle and dealing with all the issues we got, I think we can clean that up with a little bit of understanding. I want all these kids to have a fair shot when they go in that show ring, and it don't happen today. Not in the steer deal, not in the pig barn, not in the lamb barn, not in the goat barn. Part of that reason, it's become an industry, and it's big money. not just little money. I'm talking big money. We can't, and we're not going to be able to affect the change short term. It's long term with guys sitting out here, so that mom and daddy and the ag teachers and the extension agents are all thinking, you know, structure. Most of these high-end cattle aren't, the ag teachers and the extension agents ain't got a dadgum thing to do with them until they go to the stock show. And I'm not blaming them. That's not, it's mom and daddy, and it's all about, and mom and daddy's usually got a steer jock advising them. So, well, I mean, here, look, when you got mom and dad in Houston and they're pulling down 400 G's a year, you know, and they don't know a thing about it, ain't never been around a cow, and they look to a guy to consult with them, and there you go. Okay, so, but until you put pressure on things, no, that animal is going to have to be sound at the end point. They're not going to worry about it very much, and and the other thing that a lot of these folks are, the higher priced animal they are, the better they are. Mm-hmm. So, you know, I hope y'all all can tell I give this a lot of thought on this side of it, and that's the only answer I've got to affect any change, or we're going to have to deal with this, because it's what I said, 70% of these animals got it in them. We can't always identify it. I never have the opportunity. I don't get presented with these guys till there's an issue. We don't do pre-radiographs to see how many pre-sale radiographs to see like they do in horses. Although I've been advocating that to see how many of them we may be able to identify at the start. Don't do it, but it's ripe in the industry, and we just got to deal with it. I mean, it is. Back to our discussion. I know I'm fixing to go over time here, so. OCD is, in my circle anyway, is thought to be a multifactorial problem. Here's a real good description. This is what I'm talking about, digital imagery. You can't find this on a conventional radiograph. You can't find it on a lesser machine. I use a machine built by the Quattro Corporation. And this thing's ramped up as high a digital definition as you can get on a radiograph. This is in the distal talus. Medial aspect, you can see it right here. And we've gone to actual, oh, I missed it. Oh, wait a minute. We've actually gone to injecting some of these based on some of the work done in equine literature. This calf was probably a grade 4 lame when he presented last summer, and he's sound today. Genetics, and I just got one more. This is going back. I was talking about one leading sire in the club calf business, and lots of bulls out of him. And this is a dominant issue, and it may be sex linked. I've talked to nobody about it because you have to be careful in what you say. But this is a fragment off the medial malleus. I've asked a lot of experts, could this actually be a growth plate here? Although we don't find, I have radiographed a lot of young cattle. I have not found a growth plate in the medial malleus, but we see this quite often. When we see these early enough in the season, we're going to go surgically remove that because this articulates with the talus, and this can act just like a gravel in your shoe on these guys, and it adds to and causes more lesion in a lot of the really effusive or arthritic arthrosis type joints with a lot of effusion. You'll see one of these in there, and that'll occur on about 70% of that sire line on at least one limb, if not both of them. Diet, I think, probably plays a big portion in these guys, just like the equine. I have not got to read as much research on the horse end as I'd like, but they pretty much figured out that high phosphorus coupled with low copper and zinc will express these OCD lesions. And they've found that they can manipulate the diet and those foals and help that, and that's about as far as I'm going to go with that. But I think diet is really important in these guys. And if you think about them humming feed products in them, that would be where the increase in phosphorus comes from. We have not been able to duplicate that by basic blood work. Yeah, there needs to be some meeting of the minds on that to help us maybe as a predictor on these guys looking at phosphorus. I think that our feedstuffs may play into that as well with the production techniques that we currently are involved with that may lend us to more issues with lack of macro and micronutrients that could play a part of this as well. As I say, the structure on these guys is huge, is most critical. And we can see various plays on this. The sire line that I was talking about with the medial mallear lesions also are real predisposed to varus or lateral deviation of the tarsus. And they've got small toes, small hooves, and they laterally deviate on their lateral claw. And I don't know how much function, how much that change in structure, particularly toward the end point, is going to have on those guys' functionality. Am I good on time yet? Okay. Talk about, and hopefully this will get to, I'm going to breeze through these right quick, but some of the products that's used on dealing with these structural issues and joint issues, Adequan, Legend, the COX-2 inhibitors, Banamine, and maybe phenylbutazone have all been prescribed, and I think they have a place. I am a big fan of medicating these guys if we can get them early enough with intra-articular products. Some of those dexamethasone, triamcinolone, methylprednisone, and of course hyaluronic acid. And I think combinations of those are real critical in dealing with these. Just, you know, and the old deal, when I first started practice, the first 10 or 15 years, we had a big pig show and contingent there in Elgin, and they were having these pigs with swollen joints, and the breeders were calling it PPLO, and a lot of veterinarians were too. And I wondered because, you know, usually my experience with mycoplasmas, we'd usually be febrile, and none of these pigs were ever febrile. And we finally I had an internist working for me 4 or 5 years ago, and we talked about this as show season come up, and started aspirating fluid from these guys and sending it off, and we never found mycoplasma in the joint. And it's not. Now that we've got digital radiography, we put these pigs under anesthesia and radiograph for hocks, and bang, we see OCDs. And that's where the OCD was reported in animals early on, was in pigs. So why differ? And they respond the same way we medicate these guys. It's just a hell of a lot harder, and I hate hogs. So just an example, this is a shoulder being injected, and I put that in there to remind me that we treat this special. We're not going in there and mugging them up and handling the needles with our bare hands. I mean, we do a surgical scrub on the site. We're going to Centise, and we put on surgery gloves, and we're going to use a new needle. Here we're using a 6-inch spinal needle, getting this shoulder, this larger Brahman beast. So just a reminder that we need to do proper technique like we were taught in school to do these things. Talking about Legend and hyaluronic acid and so forth, there's a lot of abuse of the hyaluronic acid products, and I don't understand who come up with the idea. The people that make Legend certainly don't advocate giving Legend IM. So whoever come up with that, because the majority of this is prescribed by a lot of veterinarians, and they're okay in giving it IM. And they might as well pour it on the ground from what I'm told. So just bring that. It's very important that you use drugs as they're recommended, not come up with your own protocol, especially from a liability standpoint. I'm going to wrap this up here, but I want to show you all this because this is probably the most misdiagnosed condition that we see in the club calf world. It's spastic paresis, and unfortunately very few people get to see it until they're presented with it. It's very prolific. more often than not, these guys that are going and picking these extremely muscled up calves, the ones that are pretty posty as a baby, are the ones that are most predisposed to this. I'm not sure that vitamin E may not, or deficiency thereof, may not play a part in this. I know the literature talks about several causes, but it is a dysfunction somewhere from the tibial nerve up, and it can be very frustrating to deal with. I've got this is actually a case of spastic syndrome in a bull, and I put this up there just because this is a developmental problem. This is a 3-year-old bull, and you can see how he's in the very early stages of it. This is a Beefmaster bull, and he's got the same thing, but he's more advanced. This guy wouldn't take no for an answer. They end up having to put this poor guy down because he couldn't get up eventually. And I tried to tell him at the time we looked at this, it just wasn't anything to do. But you can see how straight these guys get those muscles that tibial nerve serves go to spasm and so bad that they can't function. And here's a calf that they wouldn't take no for an answer on either. But he was like a $20,000 embryo or something. So, and you can see this is very characteristic, and this calf's pretty advanced already. But that straight locked up extension, and he's so uncomfortable that he just sits there like that, and they'll do that all day. We usually don't go to seeing that till these guys are on in the feed period, October, November, and these cattle, when they get to that point, they're done. They won't gain another pound no matter how you feed them, and they just need to go on and meet their maker, be salvaged or whatever. Here, but we did a tibial neurectomy on this calf, and you can see we at least relieves the signs. Now I'm not an advocate and won't do one now in any cow because this doesn't need to be propagated anymore. I'm hoping that they'll eventually develop a genetic test that we can weed out the carriers of this. But you can see he's at least got relief. Now structurally, is he still sound? No. But we did at least give him some relief, and hopefully I lost track of this calf, so I don't know what became of him, but I'll bet you he probably didn't make it to the show ring. Now lastly, bucking over, and I'm going to quit. This calf, and these are not great pictures because he still had toe extensions on him, but you can see from his appearance, you see that foot is actually a good probably foot behind his shoulder, and that's the way that calf stands. And when he's made to stand up for long periods, them knees go over like that.